Patrick Moore here for OptimumSportsPerformance.com, and today I'm going to show you some soft tissue techniques that we use for the Psoas and the Iliacus. Alright, today we're talking about the Psoas, and I've got my victim here, Carson Boddicker of BoddicerPerformance.com, and we're going to show a couple techniques for Psoas and Iliacus actually. So a little bit of anatomy before we start. Our Psoas is one of our hip flexor muscles, as is the Iliacus. The Psoas actually is the only hip flexor muscle that attaches to our spine from T12 down through the lumbar vertebrae. It actually attaches onto the front of those vertebrae, the intervertebral discs, and the transverse processes of those vertebrae. As it crosses over the hip, it kind of blends in with the Iliacus there, and together they come down and attach onto the lesser trochanter of the femur. And sometimes people refer to them as one muscle, the iliopsoas muscle. I prefer not to, because I think of them kind of as two different muscles. And techniques we'll show will be separate. So the first one we're going to do is the Psoas. I'm actually going to lift up Carson's leg here, and I'm going to place my leg on the table and just rest his here in a 90-degree position. That just helps to relax the rectus abdominis. What I'm going to do is pretty much anywhere from about the ASIS, if we palpate that and we see his navel there, if we kind of draw a diagonal line, pretty much anywhere in that area, right off the rectus abdominis, right off the lateral border of it, we can kind of come in. And what I'm going to have Carson do is take a big breath in, and as he breathes out, I'm going to go in with some gentle circular motion and just kind of take up the slack. And go ahead and take another breath in and breathe out. And I'll typically do this 2 or 3 times depending on how much tension I feel. So I feel pretty good right about there. One thing I do want to caution you about is if you feel a pulse during this, just go ahead and slowly back out, reposition yourself, and then try again. Okay, so you don't want to be on anything that's beating for obvious reasons. So once I'm in here, I just want to ensure that I'm on what I need to be on. I'm off the lateral border of the rectus abdominis. I'm going to take my other hand. I'm going to have Carson go ahead and do a little bit of hip flexion. Perfect. Relax. I can feel that. And all I'm going to do, if this is really tender for him, I'll just hold here for some static pressure. If it feels okay, how's that feel to you, Carson? Perfect. Feels fine. So we'll just go ahead and we'll do a little bit of friction. Just some gentle friction along the Psoas. How's that feel? Good. And of course, we can back out, move down a little bit to treat along some of those lumbar vertebrae. We can get him moving the hip here as well, or do a little bit of pin and stretch. If I kind of hold in here and have Carson slowly extend out the leg as far as he can. A little bit of grindy there. And then relax, and I'm going to passively bring it back up for him. So that's how we do the Psoas right there. For Iliacus, what we're going to do again is just bend the leg, and I'm going to have Carson just kind of rest it out right on my hip there. And all I'm going to do is I'm going to find the ASIS, and I'm going to kind of curl right in here into the iliac fossa, and I'm going to palpate for the Iliacus. And Carson, how's that feel?
Not right.
Excellent. And I'm just going to friction back and forth, and I'll actually work right along the entire iliac fossa, kind of curling in right over the ilium there. And as we get around here, we're also, treating into some obliques, and that's okay as well, some of that lateral abdominal fascia. And I'm just going to kind of work from ASIS right into the iliac fossa there. Okay. Another way to do the Iliacus, if you have a client that's a little bit larger, is you can have them lie on their side. Perfect, just like that. Okay. And all I'm going to do here is I'm going to, again, landmark that ASIS, and I'm going to curl right in underneath it. And I can friction there, or I can actually grab Carson's leg, and I can hold and pull him into extension. And sometimes this technique actually works really well if you have a client who has larger legs, bigger, muscular individual. It kind of works well in tandem. So I would actually hold my compression here, and I would have, someone else that's in the facility that day help pull him back into extension. And of course I can also hold him and have him actively go through extension. But sometimes just having someone help with a little bit of overpressure gives him a little more of a stretch to treat the tissue. So, hope you found this information useful. I'm Patrick Ward, OptimumSportsPerformance.com. He's Carson Boddicker, BoddicerPerformance.com. Thanks a lot.